Well, the GOP is looking to overhaul Obamacare as President Trump hinted at something Americans won't see coming. Watch this.
Health care is working along very well. We could have a big surprise with a great health care package. We could have a great surprise.
This, as at least 9 GOP senators have said they will not vote for the current bill in its current form. Joining me right now is Health and Human Services Secretary Dr. Tom Price. Secretary, it's good to have you on the program this morning. Thanks so much for joining us.
Thank you. Honored to be with you today.
So Senate Majority Leader Mitch McConnell delayed the vote on this bill until after the July 4th recess now. What's your expectation here? Is the president surprised going to get this bill passed?
Well, I think the Senate will get something passed, and the reason is the situation out there in the real world continues to deteriorate. Just yesterday, it was announced that 14 of 17 counties in Nevada will have no insurance provider on the exchange next year. This is being repeated state after state after state. So the challenge is that we've got to make certain that we improve this market, improve it for patients and families and doctors to be making medical decisions, and not Washington, D.C. There are ways to do it. The Senate's working on it, and I think that they'll get it done.
Secretary, I want to ask you to talk to us a little about what has happened to Medicaid, this entitlement program. We've been having a discussion about it on set all morning this morning, and we are really astounded at how big Medicaid has become. There appears to be a lot of fraud. 1 in 5 people on Medicaid, this program was supposed to be about the poor.
Yes.
It doesn't feel like it is anymore. What has gone on with Medicaid?
Well, the original intent, as you mentioned, was for low-income seniors, for disabled folks, for healthy moms and kids, but with low income, to be in the Medicaid program so that they would have a safety net, so that they'd have health coverage and health care. Under the ObamaCare or the ACA, that was expanded significantly. So now you have individuals who are on the margins, but not necessarily vulnerable populations, healthy adults, both male and female, who are without kids, who we believe would best be suited in a more standard kind of insurance structure. But they're in the Medicaid program now, and many of the resources being used there are crowding out resources for the seniors, disabled, healthy moms and kids. So we think that it's important for those folks to be covered, yes, but that there's a better way to do that, and that is through the tax credits that we talked about previously, and a kind of coverage that works for them, not that the government forces them to buy.
Right. So there's a division within the GOP about what to do with this Medicare program. Is that where the sticking point is in terms of disagreement, why so many senators say they won't vote for it?
Yeah, there are kind of 3 different areas where there are concerns being expressed right now. One is the Medicaid program, because it was expanded by the previous administration. And again, we want those folks to be covered. We just think there's a better way to do that by and large. Second is in the area of that tax credit. How do you make certain that individuals are able to purchase coverage that they want? And then the third, which is really important, is the opioid crisis that's present across this country, and the amount of resources and targeting of resources for that crisis to make certain that we're addressing it in a way. We had 33,000 of our fellow citizens die of an opioid overdose in 2015. That number continues to go up, and we're making it an absolute priority here at the department.
Yeah, I want to ask you about the taxes within Obamacare. Earlier in the program, we spoke with South Dakota Senator Mike Rounds this morning. He said that this version of the bill is just the beginning. Listen to what he said, and then I want to get your opinion about a GOP senator saying, oh, no, let's leave an investment surcharge tax in the new health care bill. Listen to this.
What we've got right now is a bill that needs to be fixed. I think from day one, most of us had believed that it was a starting point. We were going to get a lot of things scored in it. Part of it were the tax reductions that were being proposed, the eliminations of a lot of the taxes. Some of them will stay in. I think there's one that may not, and that would be the tax on investment returns for families that make over $250,000 a year. That's about $172 billion over a 10-year period of time, which, when taken or put back into the system, would allow us to make some improvements in some of the coverages moving forward for those that need it most.
So here you have Secretary Senator Rounds in favor of keeping that Obamacare tax on investment income. A GOP senator saying, yeah, let's keep this tax in place. Will this measure stay in place despite the opposition from most Republicans?
Well, think about why the taxes were put in place in the first instance through Obamacare, and that is to pay for a significant expansion of Washington running health care. Now, if we move Washington out of the position of running health care, and again, allow families, patients, doctors to make those decisions, provide much greater flexibility for states, especially through the Medicaid program, then we believe that those resources won't be necessary, and you won't have to hold up that large bureaucracy here in Washington. So consequently, those taxes won't be necessary. That's why we believe it's appropriate for those taxes to be rolled back.
Well, Democrats are planning to protest the GOP health care bill this weekend. Several progressive groups, including the Women's March, are planning to show up at the July 4th parades across the country to hold up protest signs. What do you say to Americans who are opposing this bill and who say, you know what, I'm fine with Obamacare as it is at this point?
Well, the fact of the matter is Obamacare is collapsing before our very eyes. As I mentioned, Nevada has those 14 counties out of 17 counties that won't have an insurance provider next year. You've got about 40% of the counties in this nation that will only have one insurance provider offering coverage on the exchange next year. You've got premiums going up, deductibles going up. You've got a lot of people that have an insurance card, but they don't have any care because they can't afford the deductible. So this system in the individual and small group market is collapsing. That's what we're trying to fix. It's not that the status quo is just fine, thank you very much. The fact is that people aren't being able to go to the doctor that they want. They're not getting the care that they want. The quality of care is diminishing in that program. Access is diminishing. Affordability is going away, and that's what we're trying to address. So for those folks who say don't do anything, that's not an option because the current system is failing and action is absolutely vital.
Maybe, but you know, the messaging is really important here, right, Secretary? Because
Sure.
the left is now turning this into the Republicans own it, and it's collapsing because insurers are looking at all of this uncertainty and they say, okay, too much uncertainty, I'm out of here. So even if they weren't going to stay in the exchange regardless, they're leaving now, and your critics are basically saying, well, this is the Republicans' fault. So what are you going to tell the American people? How are you going to sell this plan?
Well, that's a convenient spin, but the fact of the matter is that before this administration came into office, a third of the counties across this country had one insurance provider to offer any coverage on the exchange. The premiums were going up, deductibles were going up, and they're continuing to skyrocket. And it's because of the structure of the program. So what we're trying to do, again, is to fashion a program that allows every single American to have access to the kind of coverage that they want for themselves and for their families, not that the government forces them to buy. The President has been adamant about this. He believes so strongly in a system that actually works for patients, not necessarily works for government. It works for patients, and that's the key.
So what kind of flexibility are you envisioning in terms of the states and Americans being able to have more than one provider?
Well, you think about that Medicaid program, and the federal government has, by and large, been telling the states exactly how to run it. But you've got to remember the different demographics in Medicaid. Seniors, low-income seniors, disabled, healthy moms, and kids. And the federal government essentially tells the states, you've got to treat every one of those individuals exactly the same, when, in fact, their health challenges are significantly different. So if the states were able to have the flexibility to provide the kind of coverage and care for each different demographic within Medicaid, they would actually increase the quality of care being provided and decrease the costs of that care. That's the kind of flexibility we're talking about that gets right to the patient, doesn't pay any attention about the government running the show, gets right to the patient.
Secretary, it's good to have you on the program this morning. We will be watching this so-called big surprise that the President has teased us about.
Thanks so much, Maria.
Thank you very much. Secretary Tom Price joining us there.